So guys, a very good morning to all. Clearly audible and visible. So this is a quick session for revision of your FMG exams in particular with the help of important MCQs, which will be a mixture of previous year questions as well as some new MCQs. I hope I am clearly audible and visible. You all can put your answers in the live chat window. The questions which we will be discussing, you will be answering first of all. So before starting the session, a quick briefing about the upcoming offers which are running around with regards to Unacademy subscription. You all are able to access the live chat window now. So this 20% discount is going on for NEET PG Plus subscription as well as Iconic subscriptions. Then Question Bank 2.0 has been launched. Then batches for integrated and system-wise courses have also been launched. So I think we are good to go. Start correct. This is the first question for today. Gender assessment is best done by which of the following bones? Gender assessment of a person is done by which of the following bones? Means which is the best bone for gender determination? This answer goes with yes, hip bone. Overall, hip ya bole ya pelvis means the same. Overall, pelvis is the best bone for gender determination according to Krogman's table. This table also we need to remember few important details about this table. Krogman's told us that what will be the accuracy of gender determination from different bones. Like if the policeman has brought all 206 bones, yes, your accuracy is going to be 100%. If he has brought only pelvis and skull, then also your accuracy is roughly about 98% for gender determination. If he has brought only pelvis, accuracy decreases further to 95. If he has brought only skull bone, accuracy further decreases to 90%. This table is also sometimes referred to as Krogman's formula. This is for gender determination from skeletal remains, which a policeman recovers. Correct? And in our pelvis bone, we remember now that basic line, how we differentiate male and female pelvis. All the parameters in pelvis bone will be large and wide, except three important parameters, that is OSA. O for obturator foramen. The size of obturator foramen is large and wide in males. S for sacroiliac articulation surface. This surface is large and wide in males. Why? Because in males, the attachment to pelvis with the sacrum is still S3 vertebra. In females, it is still S2 vertebra. So that is why the corresponding pelvis surface will also be large. And A for size of acetabulum cavity. All other parameters like greater sciatic notch, like your subpubic angle, like your preauricular sulcus, these are the most important parameters which are used for gender determination from pelvis bone, like greater sciatic notch, subpubic angle and preauricular sulcus. These all will be large and wide in females. All the parameters are large and wide in females except this OSA. Remember this exceptional thing too. Answer this one. Which IPC is related to medical negligence? A repeat question of FMG exams. Which one is related to medical negligence? The correct answer to this question goes with option C, 304A. This says whenever a negligent act has been done by a doctor or by the hospital authorities and this has led to death of the victim, then 304A is applicable. What are the other sections of IPCs which are related to medical negligence? We have three more sections, 336, 337 and 338 IPCs. 336 IPC is applicable in a scenario when the patient and or their relatives, they are coming to the police station and they are complaining that negligent act of the doctor was endangering the life of my patient, was endangering to the life of the victim. Like the doctor was going to use infected needles, infected HIV needles or hepatitis B needles in a non-HIV case. So yes, you are going to transmit a disease dangerous to life. So yes, negligent act leading to this scenario, the FIR will be lodged under 336 IPC. 37 कब applicable होगा? Whenever the complaint is that the doctor's negligent act led to simple injuries, which we legally call as hurt, mild injuries. But there are some gross injuries, or we say major injuries in the form of grievous hurt. So whenever grievous hurt has occurred due to negligent act, 338 is applicable. When death of the victim occurs, then 304A is applicable. So remember these IPCs too. These are also related to medical negligence. 304B तो सबको पता होगा. A repeat question of FMG exam itself. This deals with dowry death. Death of a married female within 7 years of marriage. And if it is proved that just before death, there was demand for dowry, either by husband or by any relative of the husband, like in-laws. And here the punishment to the accused prescribed is 7 years minimum, maximum life imprisonment. What is important is there should be a dowry demand just before death of the patient. So definition and punishment both are in 304B IPC. 300 IPC defines murder cases, and their punishment is given in, punishment for murder is given in 302, where the punishment prescribed is life imprisonment or death sentence. Now what is the minimum rank of judge who can pass death sentencing? Batao jaldi. Minimum rank of judge who can pass death sentence verdict for death sentencing is, answer, minimum rank of judge for death sentencing will be a judge having lots of D alphabets. D of death sentence goes with D of additional session judge, not assistant session. Assistant में तो कोई D alphabet है ही नहीं. So yes, it has to be additional session. Additional having lots of D alphabets. ठीक है, चलो आगे बढ़ते हैं. Let us move ahead. A female after 4 years of marriage died and one note was recovered from her. Recovered word is missing. I will add it. From her, mentioning that she was tortured for dowry. In this case, inquest will be done by. Simple question. Inquest will be done now by a magistrate under 176 CRPC. Dowry death is a type of magisterial inquest. अब अगर मान लो क्वेश्चन है कि डाउरी डेथ is investigated under, this was the thing which was asked in our exams, and suppose there are two options. This is the question. Dowry death case has happened. Dowry death will be investigated under, one option is 304B IPC, another option is 176 CRPC. क्या पिक करोगे A और B में से? These are your two options to pick. And the question is, dowry death is investigated under which of the following section? क्या हो जाएगा आंसर? Dowry death will be investigated under CRPC section. CRPC का मतलब क्या होता है? Criminal Procedural Code. All the procedures which are done by investigating authorities after a crime has occurred come under CRPC sections. So yes, inquest is a procedure. Procedure will come under CRPC section. But अगर ये क्वेश्चन ऐसे है कि डाउरी डेथ केस कंप्लेंट विल बी लॉज्ड अंडर, कंप्लेंट इज लॉज्ड बाय द पुलिसमैन इन द FIR. FIR is lodged under IPC sections. Complaint is lodged under IPC section. Answer this one. Stains over clothes when examined showed yellow color needle shaped crystals. Examined stain is, क्या होना चाहिए? Examined stain is, it has to be semen and nothing else. It has to be semen and nothing else. Yes. And the test is yellow color needle shaped crystals are formed in barbaриous testing. where you get crystals made up of spermin picrate. These crystals are yellow color, needle shape. Spermin picrate crystals. Picric acid is the reagent which is yellow color, so the crystals get yellow color. What is the source of spermin in the sample? Prostate or seminal vesicle? बता दो आप. Now it is easy na. What is the source of spermin which gives rise to positivity of Barberio's testing? Source of spermin is prostate or seminal vesicle. Answer goes with prostate. The trick to remember is, yes, R of prostate, R of spermin, R of Barberio's, R of picric. Everywhere you will see lots of R alphabets. Another test for seminal analysis is Florence test, in which we put the suspected white stain sample and then we add potassium iodide as a reagent, and then we get crystals of choline iodide, which are dark brown rhombic shaped crystals. Now, what is the source of choline over here? Iodine is the reagent. What is the source of choline? Now, to help you remember, you should remember like this. Yes, seminal vesicle has got L alphabets. This L correlates with L of choline, L of Florence. Remember this L alphabet here. What is the source of choline? The organ having L alphabet, that is seminal vesicle. So these are your two tests now, microscopic crystal based test in the form of boyfriend test for white stain analysis. Similarly, for blood stain analysis, red stain analysis, whether the sample is blood or not, we have Tieckmann's and Takayama test, TT tests. T for Tieckmann's, another T for Takayama. TT bat is red in color ना, तो याद रहेगा. Red stains के लिए TT test, white stains के लिए boyfriend test. B for Barberio's, F for Florence. A boy will have semen sample. Next one. With regards to fetal death classification, lung is dipped in water in which test? A case of fetal autopsy has been brought by a policeman, in which case I will take out lungs from thoracic cavity and I will dip it in water and look for whether the lung is floating or sinking. The answer goes with hydrostatic test, which is also called Regat's test, also called flotation test. Regat's or flotation test. ये synonyms याद रखने. These synonyms need to be remembered. So what is the principle utilized here? Weight of the lungs, specific gravity of the lungs, mass of the lungs. क्या use करते हैं? Weight of the body क्या use करते हैं? इसमें use करते हैं specific gravity of lungs is used as the principle. Specific gravity of water is 1. In stillbirth, the specific gravity of lungs remain more than 1, so the lungs sink. In live birth, the specific gravity of lungs become less than 1, so the lungs float. The thing used is, principle used is specific gravity. Pottery's test में क्या लेते हैं? इसका synonym क्या है? It is also called a static test. Here the principle utilized is weight of both lungs. Both lungs, ठीक है? Both lungs. Plockett's में क्या use करते हैं? The principle utilized is weight of both lungs is taken in numerator, and this is divided by weight of fetus itself. The test is Plockett's. All these are tests to differentiate stillbirth from live births. Redens में क्या देखते हैं? Presence of air in middle ear. Absent in stillbirth but present in live births. एक और टेस्ट है जिसमें क्या देखते हैं? Presence of air in stomach and bowel, also called as stomach bowel test or Breslau's second life test. Stomach and bowel is noted in Breslau's second life test. So these are your 5 autopsy tests which can be utilized to differentiate stillbirth from live births. Second life test. Right? बाकी USG signs है for dead born fetus, the postmortem changes in a dead born fetus. So fetal death is an important topic, short topic, important topic for all exams. Rotten egg odor is associated with, repeat question. Rotten egg odor is associated with. Answer goes with hydrogen sulfide. Aluminum phosphide has got fishy odor, rotten fish like odor, or we say fishy, and it has also got गार्लिकी ओडोर, ये दोनों ओडोर्स मिलते हैं फॉस्फाइड से, एल्यूमिनियम फॉस्फाइड, जिंक फॉस्फाइड्स. Arsenic has got garlicky odor. Phosphorus also has got garlicky odor, garlic like odor. Odor table is also important. Do revise that table which we have covered in our regular classes. Antidote to be used for iron poisoning is, antidote to be used for iron poisoning is desferrioxamine. Desferrioxamine. Ball is specifically used in which poisoning events? बाल कहाँ कहाँ बेनिफिशियल होता है? आर्सेनिक पॉइजनिंग, lead poisoning, mainly when lead leads to CNS changes, and inorganic mercurial poisoning में British anti-lewisite is highly effective. Then this ball can be utilized in any case where there is renal failure like condition, because ball का excretion कैसे होता है? Biliary route से. B for ball, B for biliary excretion. It is very safe in renal failure like conditions. EDTA is also utilized in these metallic poisons, but important चीज क्या है कि EDTA is given through IV route, and this British anti-lewisite is always given to the patient through intramuscular route, never IV route, because this ball contains fatty acid oil. If you give it through IV route, fat embolism chances will be there in the patient. Priantine is used as a chelator for which poison? Priantine. Priantine is used as a chelator for copper. Copper. तो ट्रायंटिन के साथ और क्या क्या यूज कर सकते हैं? जिंक एंड पेनिसिलामिन. Penicillamine. So these are the three chelators which are beneficial in removing excess of copper from the body, like in a case of Wilson's disease, where which gene gets defective, or in a case of copper sulfate poisoning, which gene gets defective in Wilson's? ATP7B. ATP7B gene gets defective, which regulates your ceruloplasmin transporter. If the transporter is defective, copper gets stuck in different vital organs of our body. So to remove that excess copper, these chelators can be utilized there. ATP7A is Menkes, Kinky, Steely, Hairy syndrome. A chronic alcoholic comes to casualty in disoriented state. ये क्वेश्चन है जो फिर से आएगा दिसंबर में. 4 दिसंबर को आपको एग्जाम डिक्लेयर हो गया ना, ये फिर से आएगा 4 दिसंबर. तो ऐसे टॉपिक को मिस नहीं करना है, which has 100% probability of getting repeated. Chronic alcoholic comes to casualty in disoriented state. After 2 days of this history will always be given. Sudden alcohol withdrawal, not gradual. Sudden alcohol withdrawal was done by a chronic alcoholic. So after 2 to 3 days, he will present with disorientation, agitation, tremors, along with that seizures, hallucinations. All these features are seen in the patient. Along with that, the patient will be delirious. He will present with coarse intentional tremors. Diagnosis क्या बन जाएगा? Delirium tremor. Delirium tremor. What are the features of Wernicke's encephalopathy? The person goes to Goa on a party. G for global confusion. O for ophthalmoplegia. A for ataxia. P for peripheral neuropathy. तो गोवा में पार्टी करते करते वो थक जाता है, and then he switches on the AC in a complicating stage. In a complicating stage of this encephalopathy is Korsakoff psychosis, where the person shows you with amnesia, that is loss of memory, and C for confabulation. Confabulation means filling the memory gaps with false stories. ये amnesia in particular कैसा होता है? Initially anterograde, later on retrograde भी हो जाता है, और जब retrograde हो जाता है तो condition कैसा हो जाता है? The condition of the patient becomes severe. So these are complications of alcoholism. This is the alcoholic withdrawal feature due to sudden alcohol stoppage by a chronic alcoholic. Answer this one. Came as an image based question in your exam. हाँ, बैलिस्टिक से भी क्वेश्चन रहेंगे, रेंज रिलेटेड क्वेश्चन. Microscopic crystals as shown here is seen in, one thing is very clear, that the crystals are pink colored, isn't it? They are not brown, they are not yellow. Pink color crystals are only seen in Takayama hemochromogen test, where you exactly get pink feathery crystals. Shape yaad rahe na rahe, at least remember the color. This will help you solve your question. Sequence में color कैसा होता है? Light brown. Shape कैसा होता है? Rhombic. Florence में color dark brown. Shape is rhombic. But where lies the difference? Sequence में जो sample हमें मिला होगा, that would have been red color. Florence में क्या analyze कर रहे हैं? White stain sample, whether it is semen or not. Barbario's में what is the color and shape? Yellow color, needle shaped crystal. Takayama में pink feathery crystal. Color याद रखना है, ठीक है? Pink feathery crystal. Answer this one. This is a repeat question of your exams only. Next time पता है क्या पूछेंगे आपसे? What type of weapon is used to produce this injury? तो weapon का भी type बता दो comment box में. What is the weapon type? कैसा है weapon which will produce these injuries? So best answer here is chop wound. Why? Because the wound is having clean cut margins. मैंने क्या सोचा कि ठीक है, weapon का edge कैसा होना चाहिए? It should have sharp edge. Correct? Then I am seeing crushing also. Now it is going towards the blunt injuries, but actual में blunt injury नहीं है क्योंकि margins कैसे है? Clean cut है. But crushing क्यों हो रही है? It might be due to a heavy sharp edge weapon. Heavy sharp edge weapon is the weapon type. Best example of a heavy sharp weapon will be weapons like axe or meat choppers, and that is why even vertebral bone disruptions occur. मतलब very extensive deeper damage. The weapon should be a heavy weapon. What type of wound is this? This type of wound is called chop wound. How do you define chop wound? Any wound with large gaping. Large gaping. अब देखो, इसको स्टैब वुंड क्यों नहीं बोल सकते? स्टैब वुंड क्यों नहीं बोल सकते? क्योंकि आइडियली यहाँ पे क्या होना चाहिए? स्टैब वुंड की जगह ऑप्शन क्या होना चाहिए था? इंसाइज्ड स्टैब वुंड. मान लो इंसाइज्ड वर्ड दे दिया इसमें और इसको मैंने लिख दिया इंसाइज स्टैब वुंड. ठीक है, क्लीन कट मार्जिन्स, इंसाइज्ड वुंड. डेप्थ इसमें एक्चुअली में मेंशन नहीं है. What is the length of the injury and what is the depth of the injury? When do you say an injury to be stab wound? Wherever depth of the injury is more than length. अब ये तो missing है question में. So how can you put the answer as stab wound? The best answer to mark is chop wound. Got it? अगर डेप्थ दे दिया, मान लो डेप्थ दे दिया, लेंथ दे दिया, जैसे एक मेजरमेंट, एक डायमेंशन मैंने लिख दिया that the clean cut margin wound was 5 centimeter in length, breadth was only 0.5 and then depth was suppose 8 centimeter. मैंने ये particularly mention किया है. So now I am telling you that the depth of the injury is more than length. Margins clean cut मतलब wound incised है. Depth more than length है मतलब stab wound है. तो अब आपका better answer क्या हो जाएगा? Incised stab. But here nothing is given with regards to dimensions of the injury. The best answer to mark goes with chop. Answer this one. To leave the habit of smoking, the drug used should be, which is most effective drug out of the following? Most effective modality. Most effective modality for smoking cessation is varenicline. It has got most highly effective, most effective is varenicline. And out of NRTs, nicotine replacement therapies, which can be nicotine gums, nicotine inhalers, patches, all these preparations are available. Along with that, lozenges are also available. Which NRT is most effective? NRT may be, which NRT is most effective? ये चार options, A, B, C and D. Gum, inhaler, patch and lozenges. Now the most effective NRT is lozenges. But lozenges से भी ज़्यादा effective कौन है? Varenicline. Which are the first line therapies for smoking cessation? Bupropion, varenicline and NRTs. First line first line. Second line therapies भी available है in the form of clonidine and nortriptyline. These are second line agents. Answer बताओ. Tachynoir is seen after 3 hours of death in which part of eye? Tachynoir eye के कौन से part में मिलता है? This is in a sclera part of eye. If the eyes of the person were open at the time of death, then what will happen? Due to external atmospheric conditions, what can happen is drying of a sclera part of eye, giving rise to two yellow colored triangular areas in the sclera part of eye. So initially their color will be yellow. With time, as dust particles settle, their color will change into reddish and finally to blackish. They will become black triangular areas. So this is always seen in sclera part of eye at what time of death? 3 to 4 hours of death. 3 to 4 hours of death. इसमें से आधार बायोमेट्रिक में से कौन सा स्कैन लेते हैं? आधार बायोमेट्रिक्स में which scan is used? Cornea, retina, sclera, iris. 4 options. आईज में कौन सा स्कैन लेते हैं आधार में? iris scans are taken. Eyes में तो iris scans ले लिया, bilateral iris scans. Then they take all 10 fingerprints, and then they take the best facial photograph of our life. Best photograph of your life will be taken in the form of Aadhaar photograph. ये 3 samples लेते हैं ना. This can itself become a question. Answer this one. What is the cause of discoloration of vessels as shown in image? पहले तो ये फाइंडिंग क्या दिखा रहे हैं ये पता होना चाहिए, अभी तो आंसर पे जाओगे. So cause of discoloration of vessels as seen over here, what I am saying is that the superficial veins, they have become prominent. Due to deposition of the sulf-hemoglobin pigment in these vessels, which is due to bacterial putrefaction. So this change where veins become prominent due to putrefaction is referred to as marbling. ये प्रोसेस शुरू कब होता है? This can start at about 24 hours of death due to bacterial putrefaction inside veins. But ये पूरा प्रोसेस आपको विजिबल कब होगा? प्रोसेस तो वेन्स के अंदर शुरू हो गया, but this process becomes visible. It will take some time na to get these pigments deposited. So this veins becoming prominent is visible at 36 to 48 hours. 36 to 48. Answer. Identify the image specimen which leads to blisters and priapism and it has got an aphrodisiac nature too. This insect can increase your sexual desire. It has a tendency to increase sexual desire of the person, but the outcome will be skin blisters and painful penile erection. What is this fly known as? What is this fly known as? This fly is known as Spanish fly, also called as blister beetle, also called as cantharites, बाकी जो ये ग्रीन बॉटल फ्लाई, ब्लू बॉटल फ्लाई, डोमेस्टिक फ्लाई, ये कौन से फ्लाइज हैं? These are bigger size flies, green bottle and blue bottle to be exact, which are coming to a dead body in relation to putrefaction activity. तो ये फ्लाइज आके क्या करते हैं? अपने एग्स ले कर देते हैं. उन एग्स से क्या निकलते हैं? लार्वास, which will be first instar larva, second instar larva and third instar larva depending on the size. As the size grows, staging goes from first to third. All these larval stages together are called maggots. So maggot development in a dead body is facilitated by which flies? Green bottle fly, blue bottle fly, and domestic fly. First structure to show rigor mortis is which of the following? First structure to show rigor mortis is which of the following? Answer goes with always heart. Always heart. First voluntary structure to show rigor mortis. आंसर सेम होगा या चेंज हो जाएगा? फर्स्ट वॉलंटरी स्ट्रक्चर अगर पूछे, इन पर्टिकुलर हार्ट इज इनवॉलंटरी स्ट्रक्चर, इनवॉलंटरी मसल्स होते हैं. नाउ योर आंसर विल चेंज टू आईलिड्स. फर्स्ट एक्सटर्नल स्ट्रक्चर टू शो राइगर मोटिस, आईलिड्स. आईलिड्स में राइगर मोटिस कब शुरू होगा? एट अबाउट 2 hours. Myocardial muscles go into rigor mortis or contraction at about 30 minutes of death. Yes, I can remove heart from thoracic cavity and I can show you rigor mortis in the myocardial muscles. The first structure where rigor mortis can be seen, can be elicited, can be shown is always heart muscles if in the options. And these are different ways of asking questions. Gordon's classification is for which of the following? ये repeat question है. Gordon's classification. Gordon's classified hypoxic death into that PSM worker is the mnemonic, which is being asked almost in every exam. ASHA worker. So hypoxic death were classified into ASHA types by Gordon's, and this ASHA type is anemic hypoxia, A for anemic, S for stagnant, H for histotoxic, A for anoxic. Few examples देख लेते हैं, एक example. Anemic hypoxia is usually associated with CO poisoning. Why? Because hemoglobin is in love with CO, and that love is more than 200 times as compared to oxygen. So body में क्या बन जाएगा? Carboxy hemoglobin, lots and lots of COHP. Oxygen carrying capacity of the blood will be reduced, which will give a anemic picture. So anemic hypoxia. Stagnant hypoxia कब हो जाएगा? When the heart is not able to pump out the blood, like ejection fraction is getting decreased due to any factor, or I can directly say heart failure like condition. Heart is not able to pump the blood. Histotoxic hypoxia mainly is associated with cyanide poisoning, because cyanide typically inhibits cytochrome oxidase group of enzymes of your ETC, mainly complex 4 is inhibited. Anoxic hypoxia is associated with any condition where airways are getting compromised, or I can say asphyxial mechanism are going into play, or I can say the person has gone to high altitude all of a sudden without any prior acclimatization. ब्लू कलर ऑफ स्टमक म्यूकोसा, इसमें से भी एक क्वेश्चन बहुत एक्सपेक्टेड है आपके एग्जाम्स में. ब्लू कलर ऑफ स्टमक म्यूकोसा इज एसोसिएटेड विद, आंसर हियर गोज विद अमाइटल कैप्सूल्स. एक बार क्विक रिकैप कर लेते हैं. डिफरेंशियल्स ऑफ कलर्स ऑफ स्टमक म्यूकोसा. ब्लू कलर कैन बी सीन विद कॉपर सल्फेट poisoning as well as amital capsule poisoning. Amital capsules are amobarbital capsules which were used previously to treat insomnia cases. Then black color stomach mucosa is a repeat question of FMG exams. Always remember H2SO4 in relation to blackening के साथ और क्या हो जाता है? burning. तो burning word ना यूज करके हम क्या word यूज करते हैं? charring. Mucosal burns के लिए we use the word charring. So blackening and charring occurs mainly due to H2SO4. Charring के साथ आपको yellowish tinge मिल रहा है. You are seeing some yellowness in the stomach mucosa. That can be due to this nitric acid which is yellow colored. उसके बाद you are seeing brownish or buff white, dirty white. You are not seeing actual black color, but buff white discoloration or brownish discoloration. This goes with phenol. Phenol is exceptional corrosive. No? It leads to edema of gastric mucosa and makes the stomach wall hard and leathery. That is why gastric lavage can be done. While in all other corrosives, gastric lavage is absolutely contraindicated because they lead to thinning of gastric wall, tearing of gastric wall. उसके बाद green color stomach mucosa कब हो जाता है? When someone consumes green color poisons like ferrous sulfate crystal, FeSO4. And lastly, remember red velvety stomach mucosa, red velvety. This goes with arsenic poisoning. Highly congested stomach mucosa is referred to as red velvet. मैनेजमेंट ऑफ साइनाइड पॉइजनिंग चलो लास्ट में कवर कर लेंगे, ठीक है? कन सईद लास्ट में कवर कर लेंगे once we finish the question. Postmortem caloricity is seen in all of the following except. Postmortem caloricity is seen in all of the following except. Answer goes with D. So heat stroke, Fontaine hemorrhage, strychnine poisoning, along with that any septicemia leading to death of the patient. What can happen is rise of temperature of the dead body. Normally what happens? Cooling of the dead body, after which begins after about 2 hours of death. Once the ATPs are starting to fall, dead body gets cooled up. That cooling is not seen in which conditions? These conditions, 4 important conditions. इस कंडीशन को हम एक वर्ड में क्या बोलते हैं? पोस्टमार्टम कैलोरिसिटी. Dead body temperature is rising and rising. It is not getting cooled up. Cooling of the dead body is called algar mortis. तो इसको मैं और कैसे रेफर कर सकता हूँ? Postmortem caloricity is an exception to algar mortis changes, where the dead body does not get cooled up. Instead, rise of temperature occurs. Identify the seed in image poisoning of which leads to convulsions. बताओ जल्दी. And this poison is a spinal poison. So this poisonous seed, where one crushed seed will be fatal. Fatal dose of these seeds is one crushed seed, and this fatal dose is one crushed seed, and these are nux vomica, strychnus nux vomica seeds, or we say strychnine seeds. Uchilla. Vertopsy क्या होता है? What is vertopsy? Vertopsy is option B. Use of imaging techniques like CT, MRI for postmortem examination where the dead body is not opened up. Use of imaging techniques are used, and nowadays vertopsy units are being created with respect to medical colleges. Separate blocks where medical imaging facilities will be there for postmortem examination. Those units are called vertopsy units or virtual autopsy. Option A क्या डील कर रहा है? Assessment of mental state of deceased means the person whose death has occurred prior to death. तो डेथ से पहले उसका मेंटल स्टेट कैसा था एक डेड पर्सन? तो कैसे असेस कर सकते हैं? बाय आस्किंग क्वेश्चंस फ्रॉम रिलेटिव्स एंड फ्रेंड्स, एंड दिस टाइप ऑफ ऑटोप्सी इज कॉल्ड साइकोलॉजिकल ऑटोप्सी. साइकोलॉजिकल, ये आपके एग्जाम का रिपीट क्वेश्चन. Correct answer to this question will be kidneys. Always kidneys. If a stomach is preserved with intestine in one jar, means you are able to detect the poison if it was in absorptive phase and death occurred. Liver is preserved means the poison will be detected in the metabolic phase, because during autopsy we are not aware now what was the phase of the poison. So we preserve all the organs involved in absorption, metabolism and excretion of a poison. अब excretory phase को cover करने के लिए we have to preserve kidneys. Best answer goes with kidneys. Vineyard Sprayer's lung disease is due to Vineyard Sprayer's lung disease. Answer goes with copper sulfate. Copper sulfate is a fungicidal agent. Always remember. This fungicidal agent is a part of one of the solutions called Bordeaux solution. ये Bordeaux solution कहाँ पर use करते हैं? This is used in vineyards, grape yards. So if someone is spraying this Bordeaux solution in vineyards, he will be inhaling the vapors. Over a period of the time, lung changes in the form of inflammatory changes will be seen in the lungs of the person. इस पूरे को बोल देते हैं vineyard sprayers lung disease. Occurs due to copper sulfate in Bordeaux solution. Juvenile Justice Board is presided by which of the following? Juvenile Justice Board is presided by which of the following? Juvenile Justice Board is presided by first class judicial magistrate. First class judicial magistrate. And there the magistrates are referred to as, they are called as principal magistrates. It is the first class judicial magistrates who are called as metropolitan magistrate or MM in metro cities. In metro. कैसे होता है जुवेनाइल जस्टिस बोर्ड का कॉन्स्टिट्यूशन? सेंटर पे एक प्रिंसिपल मैजिस्ट्रेट होगा, ठीक है, preferably it should be a female. If at all not available, a male can also preside juvenile courts. इस फीमेल के साथ दो लोग और होते हैं, टू फीमेल सोशल वर्कर्स. ये तो फीमेल ही होना चाहिए. But judge ideally should be a female judge, but suppose the female judge is not available for some or the other reason, so a male principal magistrate can also preside over, but the social workers will always be female social workers. पावर ऑफ जजेस एंड ऑल अच्छे से रिवाइज कर लेने, बहुत बार रिवाइज कराया हुआ मैंने भी. ऑल आर फीचर्स ऑफ मेल स्कल एक्सेप्ट, all are features of male skull except. The correct answer goes with option D. मेल स्कल में सब कुछ ही प्रोमिनेंट होता है, लार्ज होता है, एक्सेप्ट फ्रंटल एंड पैराइटल एमिनेंस. एक्सेप्ट फ्रंटल एंड पैराइटल एमिनेंस. फर्स्ट कार्पल बोन टू ऑसिफाई ओवरऑल. फर्स्ट कार्पल बोन टू ऑसिफाई इज कैपिटेट, कैप्टन है ना ये. कैप्टन सबसे पहले ऑसिफाई होगा, एंड कैप्टन बोलेगा मैं टीम में सबसे बड़ा हूं, out of the team of 8 carpals. That is why we learn na, capitate is the largest carpal bone, and captain will ossify or mineralize first. Which is the last carpal bone to ossify? First की जगह word कर दिया मैंने last. एक bone है जो हमेशा pitched off रहते, that pitched off bone is called pisiform. एक बार quickly revise कर लेते हैं. All your carpal bones ossification age, important area है. टीना लीना टिंडे पकाओ, टिंडे तुम्हारे कच्चे. कच्चा also stands for capitate. Capitate ossifies at 2 months of age. Hamate ossifies at 3 months of age. Pisiform pitched off रहता है, 9 to 12 years पे mineralization होता है. Triquetrum goes with the names. Tri means 3 years. Lunate ossifies at 4 years. And ये तीनों carpal bones roughly between 4 to 5 years. हाँ, जो भी निमोनिक से याद रहे, याद रखना, याद रहना चाहिए. मुद्दा ये है कि याद होना चाहिए. Vascitis uterinalis, बट निमोनिक ना एक लेवल तक ही होने चाहिए. ज्यादा निमोनिक्स कर लोगे ना तो फिर निमोनिक्स को कैसे याद रखें? निमोनिक्स should be there, but understanding a topic is more important. निमोनिक्स डायरेक्ट मगिंग करना है, निमोनिक्स बनाना है, that is a wrong way, wrong approach. First try to understand things, and जहां पर टफ हो रहा है बहुत ज्यादा, वहां पर निमोनिक्स will be handy. क्योंकि 19 सब्जेक्ट्स है ना, कितने निमोनिक्स याद करो? एंडलेस है, मेडिकल साइंस इज एंडलेस. Vascitis uterinalis क्या होता है? Vascitis uterinalis is when the head of the child was inside uterus, rupture of membranes occurred, and then cry of the child was heard by the doctor. This is called vascitis uterinalis. Option B क्या डील करता है? This is referred to as vascitis vaginalis. When the head was inside vaginal cavity when the fetus was getting delivered and the cry was heard from there. It is called vascitis vaginalis. Constricting force required for obliterating carotids in hanging cases. कितना pressure चाहिए होता है? How much pressure is needed? Answer goes with 2 या change है. Answer goes with, it is not 2, it is 4 to 5 kg. Carotids and arteries के लिए we need great pressure. 2 kg pressure is needed for obliterating or constricting internal jugular vein. Internal carotid artery के लिए 4 kg. 15 to 20 kg pressure is needed to compress larynx and trachea. Larynx and trachea. Compression of IJV will give rise to venous congestion. Compression of internal carotids, which are going to supply on from both the sides, supply to the brain is going to happen. अगर ये supply obstruct होगी तो what will happen? Cerebral hypoxia. Compression of the airways will give rise to asphyxial mechanism. And we say now, what is the most common cause of death in hanging cases? A combined effect of all three events. Venous congestion, cerebral hypoxia, and asphyxia is going to kill the person. All are different types of strangulations except exception pick करो. कौन सा strangulation नहीं है? Which one is not a type of strangulation? And today and tomorrow now I have kept 2 special classes for FMG aspirants in particular. Those special classes will be from 11:30 to 12:30 today and tomorrow in Unacademy app. For FMG exams in particular, बाकी NEET PG aspirants भी attend कर सकते. All are different types of strangulations except कौन सा नहीं है बताओ? Gagging. What is gagging? Obstruction of oronasopharynx. What is Banstola? Strangulation by bamboo sticks. What is garroting? Strangulation by iron collars. IRON, iron collars. What is mugging? Strangulation by bend of elbow or bend of knee or sole of foot. What is manual strangulation? Strangulation by hands, also called as throttling. Manual strangulation is also called throttling. And one more type of strangulation deaths is there, that is ligature strangulation. But gagging is obstruction of oronasopharynx by cloth-like substance or handkerchief. One of the types of garroting is Spanish windlash technique. It's just similar to garroting. इसका आंसर बताओ. Under NDPS Act, following substances are included except. Under NDPS Act, following substances are included except. कौन सा नहीं होता है? कौन सा नार्कोटिक ड्रग साइकोट्रोपिक सब्सटेंस नहीं है? वाह, एम्फिटामिन नहीं है. एम्फिटामिन मर जाएगा बेचारा. एम्फिटामिन सुसाइड कर लेगा. तो मैं इतना पोटेंट साइकोट्रोपिक एजेंट हूँ और लोग मुझे कह रहे हैं कि मैं नहीं हूँ. तो इसको पहले क्लासिफाई कर लेते हैं एंड द आंसर विल इटसेल्फ कम. What is the list of narcotic drug according to this act? Narcotic drug consists of cannabis, cocaine, opium is extracted from unripe poppy capsule. Opium को ही अफीम बोलते हैं. Crude opium is called अफीम. इस ओपियम से एक्सट्रैक्ट कर लिया मैंने, बट 100% एक्सट्रैक्शन तो नहीं होगा, कुछ तो रह जाएगा ट्रेसेस. वो जो अनराइप पॉपी कैप्सूल के ट्रेसेस रह गए, जब वो पॉपी कैप्सूल का प्लांट से हम अफीम निकाल लेते हैं तो वो ड्राई हस्क बच गया. दैट ड्राई हस्क इज आल्सो कैटेगराइज्ड एज नार्कोटिक एजेंट. नहीं तो लोग क्या करने लगेंगे? इसी को कमर्शियल यूज में करने लगेंगे पैसे कमाने के लिए, इसी को कंज्यूम करने लगेंगे, क्योंकि पॉपी स्ट्रॉ में भी सम ट्रेसेस ऑफ ओपियम इज स्टिल देयर, इसलिए इसको भी इंक्लूड किया गया एज नार्कोटिक ड्रग. Psychotropic substance list is very long. Important examples are hallucinogen group of agents, जिसमें आ जाते हैं आपके LSD, other agents like amphetamines, ये सब आ गया ना साइकोट्रॉपिक सब्सटेंस में। बेंजोडायजेपिन ग्रुप ऑफ ड्रग्स, ये भी साइकोट्रॉपिक सब्सटेंस में। तो क्या नहीं है, क्या नहीं है? अल्कोहल एंड निकोटिन, अल्कोहल एंड निकोटिन। मेजर सोर्स ऑफ रेवेन्यूज आर दीज एजेंट्स, तो इनको रख देंगे तो फिर तो खेल ही खत्म हो जाएगा। तो अल्कोहल एंड निकोटिन आर नॉन नार्कोटिक सब्सटेंस। बट नार्कोटिक्स में कैनाबिस, कोकेन, ओपियम, पॉपी स्ट्रॉ, hallucinogen group of agents, amphetamine, benzodiazepines, important examples for psychotropic substance. लुमिनेसेंट, लुमिनेसेंट मतलब लुमिनस। क्या क्या लुमिनस हो रहा है? फीकल मैटर, फीकल मैटर को अंधेरे में रखेंगे तब पता चलेगा लुमिनोसिटी। सन में रख के अब फिर देख रहे हो लुमिनोसिटी तो नहीं पता। तो luminescent feces and vomitous matter will be seen in which poisoning event? If you keep these samples in dark room, this is associated with yellow phosphorus poison. Yellow phosphorus is the toxic variety. Phosphorus is a luminous poison, always remember. And it also shows spontaneous combustibility even at room temperature. What do you mean by posthumous child? Posthumous child क्या होता है? Posthumous child is child born after death of his father. At the birth of the child, the father is already dead. The child is called posthumous child. Most reliable test for identification of a blood stain. Most reliable test is spectroscopic examination of the sample where different band patterns of different hemoglobin pigments are formed. So it can be utilized for old samples, washed samples. It detects hemoglobin pigments. अब ये pigments putrefaction case में क्या हो जाएगा? Sulf hemoglobin pigment that will give a different band pattern. फ्रेश डेड बॉडी है, ऑक्सीहेमोग्लोबिन पिगमेंट पैटर्न्स फ्रेश ब्लड में। फिर उसके बाद डीऑक्सीहेमोग्लोबिन का अलग बैंड पैटर्न, कार्बोक्सी हेमोग्लोबिन का अलग बैंड पैटर्न। It detects hemoglobin pigments, so the sample is blood and nothing else. That is why it is most reliable, or we say gold standard confirmatory test. Macerated fetus indicates which of the following? Live born, dead born, stillborn. या ऐसा लग रहा है कि ऑल ही लगा दे? क्या लग रहा है? मैसेरेटेड फीटस क्या इंडिकेट करता है? क्या इंडिकेट करता है? Macerated fetus indicates that the fetus has died inside uterus, because what is maceration is nothing but aseptic autolysis by body own enzymes, that is lysosomal hydrolysis. Because female is still alive, bacterial putrefaction is not occurring, but yes, maceration changes can occur due to body own enzymes like lysosomal hydrolysis. What is the first sign of maceration which the doctor will elicit during autopsy? First thing which will be noted is skin slippage, occurs very early in dead born fetus. Skin slippage, ergosity of the skin is lost, and the fetus now gives a, after aseptic autolysis also, the fetus gives a sweetish disagreeable odor. अब इसका मतलब क्या है? I don't know. This is how it is written in literature कि मीठा होगा और जो आप सहन नहीं कर पाएंगे। डिसएग्रीबल का ये मतलब हुआ ना असहनीय। Sweetish disagreeable odor will be there in a macerated fetus. The first sign noted by the doctor will be skin slippage during autopsy. In which test? अब बताओ, ये तो अभी रिवाइज किया ना पीछे, यहाँ पे इन्फेंट की जगह फीटल ऑटोप्सी होनी चाहिए। Weight of the lung is compared to body weight in fetal autopsy in which of the following tests to differentiate stillbirth from live birth? में करते हैं, इसमें करना पसंद करो, कौन सा टेस्ट करना पसंद? अभी तो किया था पीछे रिवाइज हमने, अभी जस्ट few minutes back. तो इसको everyone should tell this correctly. Plockets, plockets. देखो इसमें कंपेयर क्या कर रहे हैं? वेट ऑफ द लंग इज कंपेयर टू बॉडी वेट। केवल होता ना कि इन विच टेस्ट वेट ऑफ द लंग इज यूटिलाइज्ड, तो आंसर हो जाता फॉड्रीज टेस्ट एंड स्टैटिक टेस्ट। द वेट ऑफ द लंग डिवाइडेड बाय वेट ऑफ द बॉडी प्लॉकेट्स। फर्स्ट और सेकंड लाइफ में तो एयर का डिटेक्शन करते हैं इन स्टमक एंड बाउल, एयर इन मिडिल ईयर रेडिंस टेस्ट, lungs are floating in water or not, hydrostatic flotation or Ragat's test. In which type of hanging constricting force is weight of the whole body? लग रहा है आसान क्वेश्चन ना, बट गलत हो जाते हैं ऐसे क्वेश्चन। बताओ आंसर बताओ। This is how we cover in our regular classes ना, the classification of hanging deaths। तो इस क्लासिफिकेशन से क्वेश्चन आ सकते हैं like this. Suppose a person has done the act of hanging. This was the fellow. He has used this is one scenario, and second scenario is this. This is the chair, the ground, and the person is sitting over the chair. Now, in these two scenarios, what has happened is, in scenario number one, person has used a ligature, tied this ligature around his neck and tied this to ceiling, and the ground was much above him. He was completely suspending in air. This type of hanging is called complete hanging, correct? And complete hanging, mein what is the force which is compressing the neck or constricting the neck? Weight of whole body. Weight of body. This was the question. अब ये दूसरा सिनेरियो क्या कह रहा है कि सपोज द पर्सन यूजेस अ ligature and ties this to the ceiling. Some part of the body is touching the ground, so the body weight will be distributed to the ground here. Now the major role for constricting neck in this case of partial hanging or incomplete hanging is said to be weight of head of the person playing a major role as compared to weight of body of the person. Weight of body will also play a role, but weight of head now will play a major role. Typical hanging क्या होता है? When the knot is at, knot जो है वो कहाँ पर है? Mid occipital area में. This hanging becomes typical, not anywhere else, atypical. Judicial hanging is which type of hanging? Atypical hanging. And death in judicial hanging is due to which of the following? Is due to which of the following? Death in judicial hanging is due to fracture of C2 C3 vertebra, also called as hangman's fracture. कई बार ना इस hangman's fracture को इस तरह से भी लिखा जाता है. Hangman's fracture is traumatic spondylolisthesis. आपके एग्जाम का क्वेश्चन है. Of C2 over C3 is called as. This is nothing but another name for hangman's fracture, which mainly occurs in judicial hanging case. Traumatic spondylolisthesis of C2 over C3. Outer covering of diatom is made up of. Outer covering of diatom is made up of silica. Silicaceous coating. इसका नाम क्या होता है? Outer covering of diatom made up of silica is called as. तो क्या बुलाते हैं? फ्रस्ट्रेटिंग क्वेश्चन है, आ चुका है कि एक एग्जाम में. इसका नाम भी है, इस कोटिंग का नाम होता है फ्रस्ट्यूल. आउटर कोटिंग ऑफ डायटम मेड अप ऑफ सिलिका इज कॉल्ड फ्रस्ट्यूल. फ्रस्ट्रेटिंग क्वेश्चन. एक क्वेरी रह गई यार ना, वो साइनाइड पॉइजनिंग मैनेजमेंट. कोई बात नहीं, अभी स्पेशल क्लास है ना. स्पेशल क्लास इज इन अनअकैडमी ऐप टुडे फ्रॉम 11:30 AM ऑनवर्ड्स. तो वहां पर मैं ये कवर कर लूंगा, ठीक है. साइनाइड पॉइजनिंग मैनेजमेंट एक्चुअली इज टाइम टेकिंग थिंग. साइनाइड मैनेजमेंट वहां कवर कर लेंगे. हुज क्वेरी वाज दैट? क्वेरी था ना, नाम भूल गया मैं. सईद मसूद की क्वेरी थी. इसको कवर कर लेंगे यार, ठीक है, इस सेशन में 11:30 AM to 12:30 PM. Today and tomorrow, this special class is dedicated for you all, for FMG aspirants in particular, where again we will be trying to revise important areas. बाकी आपकी जो भी डाउट्स क्वेरीज होंगी ना, इसमें सॉर्टिफाई हो जाए, ठीक है. because I will have to end the session. So then, bye bye, bye bye. Keep your spirits high. Let us meet at 11:30 a.m.